Secretary Shalala, you were Health and Human Services Secretary. Right now, that's the big story in the news, the debacle of the healthcare website and all sorts of associated questions about whether the Affordable Care Act would work. Based on your knowledge of the federal healthcare system and your knowledge of government generally, how did this debacle happen in your view?
Well, I think, first of all, I don't think the government is particularly good at technology, but I also don't think the private sector is either. I mean, if you look at the stretch that it's been for all of us in introducing medical technology and other kinds of things, even VA went through a period, but they didn't have the cameras on them. This is a software problem. It's solvable. Should it have been tested before? The secretary would have said that. It should have been pre-tested. They probably should have laid it out in a different way. There's not a conceptual problem, though, with the program itself. All they're trying to do is to give larger numbers of people who don't have health insurance, make sure they get subsidies to pay for it. So I think they're going to get it solved if they're allowed the time to work through the challenges. If the states had decided to do it on their own, we wouldn't be in the middle of this. The fact is, they had to set up a national system, and they never thought they were going to have a national system. When the program first was rolled out, remember, the states were going to run the exchanges. They were going to put people on their Medicaid platforms, which they already had. So yes, it's a debacle. Yes, they have to work it through, but they have to work it through within the glaring light of politics. And every misstep, whether it's misspeaking or it's something else, is going to be caught. So there's not room for error. That's the nature of politics now. But I understand how it could happen because I've been there. I got nervous every time we had to do some big scale thing, whether it was the privacy regs or getting millions of children on the kids' health insurance or immunizations. Just made me nervous because these big scale things are hard to do, and
so far,
they're
there's
hard
not
to
been
manage.
any single person within the government at a senior level who's been held directly accountable.
Well, the secretary has taken responsibility for that, for the whole thing. And at the end of the day, the secretary is the person responsible. Whether they had, there are people that had the titles as such, but it's the interface between the technology and actual people that have to use the technology. And it's just a complicated software problem, and it looks like they're going to be able to smooth it out. I got on the other day, and I didn't have any particular problem. It was 1 o'clock in the morning, but listen, Part D was horrendous. I remember that Christmas vacation. My mother had a schedule for me of every elderly person she knew to get them on Part D. And the people in the administration that ran Part D went through the same kinds of pain. Everybody said it wasn't going to work. It wasn't quite as partisan. But these big programs are hard, and you can second guess them. But at the end of the day, if we can't do anything, I know we can do software and we can sort it out.